you want to start. Perfect. Well, hello and welcome to the second session of the Pharmacists and Pharmacy Technicians as Cancer Prevention Champions series. On behalf of the American Cancer Society, I want to thank you all for taking time out of your busy schedules to join us today, whether that's live or via recording in the future. Today's session will focus on HPV evidence-based intervention and ways you can become immunization champions. If you want to go to the next slide. So I'm Ashley Locke. I'm an HPV program manager working on our disparities work here at the American Cancer Society. I have the honor of talking with you first, but I am a part of a much larger team that encompasses many colleagues from the American Cancer Society who also do work on increasing HPV vaccinations. I will be your moderator for today's session. In just a few minutes, I'll be introducing our presenters for today's session. Next slide. In the spirit of the holiday season, we did an icebreaker last month and would love to do another one this month. So please, share your name, organization, and favorite holiday tradition in the chat, and I will make sure to react there. So go ahead and do that. Next slide. So while you're, sharing all your holiday traditions in the chat, I will share just a quick roadmap for today's session. So right now we are reviewing just a few housekeeping items. Soon you'll hear from our presenters, Erica Thompson and Chantel Parker, followed by a panel. So I do want to share a few quick reminders for today's session. This session is being recorded and will be posted to a public-facing website. This session is certified for continuing education. We've added a link in the chat detailing out information for live continuing education credits. So for continuing education purposes, I would like to share just a few disclosures with you. Erica Thompson receives consulting fees through the advisory board and has contracted research and is a part of the Speakers Bureau for Merck. Additionally, both Chantel Parker and Tram Nguyen, who are employees of Walgreens. None of the other planners or speakers involved with the HPV vaccination pharmacy series have anything else to disclose. And just know that the Zoom chat is open for comments, questions, and any support you may need. Next slide. So we are going to do a quick poll to start today's session, and this is really just looking at where everyone stands with their role increasing HPV vaccination uptake, knowledge on evidence-based interventions, and just recommending the HPV vaccine. So we'll do the same poll at the end of the session, but want to get your feedback right now. Just give you guys a few moments. Gila, how are we looking with uptake of the poll?
It looks like we're at about 15 people, about 78%.
Perfect. We would love to hear from a couple more. Just give you a couple more seconds to complete that. And those that are just joining us, please feel free to type your name, organization, and a holiday tradition in the chat. We would love to look at them and read them. Appreciate anyone that has done that so far.
We've been pretty steady. I'm going to go ahead and end the poll.
Perfect.
Do you want me to share those results for you?
Sure, absolutely. All right, it looks like for question one, majority of you agree or strongly agree, which is great, in terms of evidence-based interventions that you could implement in your pharmacy. It's kind of across the board, but majority, 60% say they agree, and know what interventions to do. Routinely recommending the vaccine. So 47% agree, 13% strongly agree, and then the other half are either neither agree or disagree. And then when we're looking at currently implementing interventions, majority say no. but there are some that say yes. So hopefully today's session will help you guys feel empowered to do something within your pharmacy. So go ahead and stop sharing that. Thank you, Kayla, for doing that. So for today's session, we will be focused on the following learning objectives. We're going to be discussing the importance of the HPV vaccine. We're going to be identifying pharmacy solutions to vaccination barriers. We're going to be reviewing evidence-based interventions to increase HPV vaccination in your pharmacy. And then we are also going to be explaining how to increase on-time HPV vaccination rates. So without further ado, if you want to go to the next slide, I'm happy to introduce our speakers for today's session. So Erica Thompson is the Associate Professor for Department of Quantitative and Qualitative Health Sciences at UT School of Public Health in San Antonio. And then Chantal Parker, who is a healthcare specialty service at Walgreens. So I will now pass it to Erica to do a recap from session one.
Thank you so much, Ashley. I'm delighted to be with you all here today, and I'm just going to do a very brief recap of some of the highlights related to HPV and HPV-related cancers. So if we go to the next slide, and many of you, I'm sure, are familiar with this, but what is HPV? HPV stands for Human Papillomavirus, and I think one of the key takeaways is it's a very common virus. Most people will be affected by HPV sometime in their lifetime. That's because HPV is a prolific virus and that there are over 150 types of HPV. But it's those subtypes, about 15 of them, that can cause cancer or precancerous symptoms that give us the most concern. Because it shows that if someone is infected with HPV from one of these types and that infection sticks around, that's when it's more likely to transition into a precancer or cancer. But I do want to give the good news is that most infections will clear on their own. Your body's immune system does a good job at suppressing that infection. But again, it's those infections that persist which cause the most concern. And it's typically you get infected by HPV early around the time of sexual debut. So young adults and adolescents where we see the highest number of infections. Next slide, please. So as I mentioned, it's that connection to cancer and precancers, which is why HPV is so concerning to us. And it has multiple impacts on population health. So if we look at kind of this pyramid of those population health impacts, there are about 2 million abnormal pap smears for cervical cancer each year. So HPV causing those abnormal pap smears due to changes in the cervix. Going up above that, there's also low-grade cervical dysplasia, which can stem from that as well. And, you know, while these aren't necessarily cancer themselves, it can lead to cancer, and there's a lot of psychological, economic consequences associated with these health outcomes, as well as additional procedures that are required. Now, some of the types of HPV that aren't cancer-causing can also cause genital warts, so that's also here on the list. And then we progress up all the way up to high-grade cervical dysplasia and ultimately about 37,800 HPV attributable cancers each year. So that's the tip of the iceberg in terms of population impact and resulting in morbidity and mortality. Next slide, please. And so if we zoom in on that tip of the iceberg and look at those HPV attributable cancers per year, you can see here that the breakdown in terms of sex, male and female, male being the blue color, female being that pinkish color. And I really want to emphasize that the most diagnosed HPV-related cancer is oropharyngeal cancer. So something we may not typically think of when we think of HPV and cancer. I think a lot of our minds go to cervical cancer. But really, the oropharyngeal cancer now makes up a bigger proportion, largely among men, as shown on this diagram. But as you can see, HPV causes 6 different types of cancer, as indicated, including, in addition to the ones I already mentioned, anal cancer, vulvar cancer, penile cancer, and vaginal cancer. Next slide, please. And if you're really wanting to learn more about that connection between HPV and oropharyngeal cancers, here's a little bit more data related to that. So as we mentioned on the last slide, there are about 15,000 cancer cases per year of oropharyngeal cancer attributable to HPV, most affecting men. And if we look at this figure on the trends in HPV-associated cancers for the past 20 years, if we look at the top, one of those lines, that purplish line is indicating oropharyngeal cancer incidence among men. And you can see we're seeing an increase in that number of new cases, or that rate of new cases among men. In contrast, that greenish line is cervical cancer, and we've seen a decline in that cancer among women. Toward the bottom are those other HPV attributable cancers, and also seeing some moderate increases related to anal cancer and vulvar cancer as well. But really, the take-home message being that oropharyngeal cancer has now surpassed cervical cancer as the most common HPV-related cancer. And what makes this even more concerning in terms of prevention is that while something like cervical cancer can be prevented not only through HPV vaccination, but also through cervical cancer screening, because we have successful cervical cancer screening programs, we don't necessarily have that for oropharyngeal cancer. We have HPV vaccination in our tool belt, but there's no clinical endpoint to be able to do some sort of oropharyngeal cancer screening to help have an earlier diagnosis or earlier detection. So next slide, please. So that's why it's really essential that we focus on HPV vaccination as our primary prevention strategy. And 2 shots of the vaccine can prevent 6 types of cancer. Next slide, please. So when I say 2 shots, and that's because if we can vaccinate both boys and girls by age 12, but typically between ages 9 and 12, they only need 2 doses of the vaccine. So that's great. And those doses are 6 to 12 months apart. If they're a little late, so if they didn't quite make the 9 to 12-year-old range, ages 13 to 14, they still only need 2 doses. But if they're ages 15 to 26, then they would need 3 doses. They need that additional dose beyond the age of 15 when they started the vaccine series. However, whatever age the patient starts their vaccine series is how you determine the number of doses that they would need. And we just want to note that if a patient doesn't need to restart the series, if there's been a long delay, they again just follow that dosing guideline based on when they started the series. And in addition, the Advisory Committee on Immunization Practices has also issued guidance that persons who are 27 to 45 who have not been adequately vaccinated could get the HPV vaccine based off of a shared clinical decision with their healthcare provider. So next slide, please. So now that we've briefly refreshed what the guidelines are and what HPV is and HPV-related cancers, I want to just highlight these powerful HPV vaccination messages that you'll probably see come through in some of the communication and intervention strategies that Chantel will share with us. First and foremost, HPV vaccination is cancer prevention. It is a safe and effective vaccine, and we're happy to share additional resources about that in the last webinar. You can see the details on that. The vaccine is for all children, boys and girls, because it can prevent a range of cancers that affect both men and women. The vaccine is best when given between the ages of 9 to 12. That's when it works the best and is recommended, and it can prevent 6 types of cancer. So I'm now delighted to pass on the stage to Chantel Parker to go over some of the interventions that you all can engage in.
Awesome. Thank you so much, Erica. So welcome back for our second installment here. And then welcome for the first time for those who could not join us on our last call. So I want to quickly go over the HPV evidence-based interventions and our role in the pharmacy as immunization champions. Go to the next slide, please. So we know that pharmacists and our pharmacy technicians, by extension of us, can play an important role in disease prevention by advocating and administering immunizations. So if we look through some of those interventions and advocacy efforts that we have, I'd like for you all to just kind of throw some of those in the chat, some things that you do maybe on a daily basis to ensure that you are protecting your patient population. Next slide. We know that as we continue to advocate for immunizations for our patients, there will be some barriers that pop up. We covered these on the last call, so I'll quickly go through them. We know that there's limited access, some missed opportunities by healthcare professionals, lack of primary care physicians, lack of personal knowledge about vaccines, difficulty recalling child's past vaccinations, some demographic and socioeconomic factors, and then lastly, the fear of mistrust of immunization efforts. Next slide. So we also know that as pharmacists, we are the most accessible healthcare professional. So we have solutions to many of these problems. One, limited access to clinics. We know that 90% of the population lives within 5 miles of a pharmacy. Our hours are more convenient for our families and patients. If the client is over 14, we can recommend and vaccinate during any encounter, prescription pickup or vaccine visit. And then if the client is younger than 14, we can recommend the vaccine and reach out immediately to that primary care physician to get a prescription to vaccinate. Next slide. If you have any specific barriers that you've experienced in practice, you can throw those in the chat as well, or raise your hand and come off mute and kind of talk through them. I'd love to hear if you guys have any success stories, either previously or definitely between, the last call we had and this call. So looking at some of the missed opportunities by healthcare professionals, we know that as pharmacists, we can educate and vaccinate at every encounter. And we can also follow up with providers to say, hey, this patient might have missed this opportunity when they were in office with you. Let's go ahead and get them taken care of today. Additionally, when we talk to our patients, we know right now is, peak season for respiratory. I saw a demographic that we are in the higher range of influenza-like illness right now, especially in the state of Texas. So as people are being pushed into the pharmacies, let's go ahead and remind them to get vaccinated while they're there. Next slide. When you look at the breakdown between the parents' willingness to vaccinate their children at pharmacies, we know that there has been some great uptick when it comes to flu at 62%. However, we do know that between Tdap, meningococcal, and HPV down at the bottom, there are some missed opportunities. I think there's a little graphic, if you click through one more time, that comes up on this slide, that identifies those three vaccines as a possibility for us to intervene and chat through that with our patients. Next slide. And if we drill down into it a little bit more, most parents don't even know that they can get the HPV vaccine at pharmacies. So we're well known for flu, we're well known for COVID, but I just think across the general knowledge of the public, they might not know that there are other life-saving vaccines that they can receive. So how do we increase HPV and other adolescent vaccine awareness and acceptance within our pharmacies? Next slide. All right, so another barrier, lack of personal knowledge about vaccines. So I think if you look at just the education pieces, do we have up posters? Are there bug slips and other things that we can use to make sure that we're displaying information? Deliver a strong presumptive recommendation. If you go back to webinar number 1, we spent quite a bit of time about that. And I think we'll cover a few examples today as well. And then you can always provide that one-on-one education, especially during consultation, give patients the information that they need, and host a vaccination educational session. So you can partner with schools, community organizations, and just give them information that they need that they might not have previously had. Yep, I see that. Acceptance is a big barrier to overcome. Thanks, Roxanne. Yep, it's preventable and highly effective. I love it. Next slide. So if you're like me and you have difficulty recalling your child's past vaccination history, we know that there are various databases. Checking MTrack, calling the PCP for immunization records, and then making sure that you have that record printed. I know personally, anytime my kids need a vaccination record to go to camp or to go, to participate in an extracurricular activity, I either call the school nurse because I know they're going to get it to me quickly, or reach out to their PCP to get a copy of that immunization record. So just make sure you share that. I know there are companies that have a lot of different resources where patients can just quickly log in and see what vaccines they've received. And similarly, with a lot of MD offices with patient portals and MyChart and various things, that you could easily get that information and know where your child stands with various vaccines. Next slide. Fear or mistrust of immunization efforts is a big one. I think that goes back to the acceptance that was just discussed in the chat. We want to make sure we are equipped with resources and appropriate language, respond to questions and concerns with facts. We'll cover that in some upcoming slides. Use active listening and motivational interviewing techniques to overcome hesitancies, and then share your personal experience with the vaccine. I provided this vaccine to my own kids. I know that's a personal story that I always share. Luckily, we have a very vaccine-forward pediatrician in our family. So my 11-year-old and 15-year-old have already been fully vaccinated. I will say with the 11-year-old, getting them back in for that second visit was a little bit more difficult. So why not use that as an opportunity to talk through those options with patients if they are having trouble getting a vaccine scheduled with their provider? They're in our pharmacies, and we know the appropriate steps we need to take to get them vaccinated. Next slide. Demographic factors and socioeconomic status also comes up. There's a wealth of resources. They can find a safety net clinic at the below. So you might have a patient that comes in, they're uninsured, underinsured. It's too expensive. You don't know how to help them. Give them the safety net clinic resource to ensure that they get access to what they need. And then Vaccines for Children program, and also providing a list of any upcoming vaccination events, Health and Human Services posts, and other community organizations. Yep, I like that, Deborah. You share the experience with all patients to reassure them of the process and that it's safe, and that your kids are still around, nothing has happened to them. So that's awesome. Thank you. Next slide. Okay, we're going to talk through how to overcome some of those barriers. We talked about solutions, and we now have some evidence-based interventions. If you're familiar with any of the EBIs, go ahead and throw them in the chat, and we can kind of talk through it. I think the good news is over the next several slides, we hope to help ease, your hesitance with getting patients the vaccines that they need. So what are evidence-based interventions, or EBIs? They are approaches to prevention or treatment that are peer-reviewed and have documented empirical evidence of effectiveness by research and evaluation. They're evidence-informed interventions that use the best available research and practice knowledge to guide program design and implementation, which is super important because we know that there's a lot of misinformation out there, and we need to combat that with science-backed, evidence-based approaches that reassure our patients that these are safe and effective. Some advantages of EBIs are increasing the likelihood of a successful initiative, increasing the cost benefit by saving time and resources, including during planning and in the implementation phase, adding value and evidence when describing your program and sharing your plan with various stakeholders, and then defining what to evaluate and where you're looking for impact. Next slide. There are about 3 different categories of interventions, and we know that they all work best when used in combination. So we're going to go over a few client-directed interventions. We'll look at some provider-directed interventions, and then interventions to increase community access, and how pharmacists kind of work throughout all 3 of those. Next slide. All right. I know this is a bit of an eye chart, but there's a couple takeaways. One, the green circle are things that are recommended and have been proven to be successful. The yellow diamond is things that have not enough evidence or insufficient evidence to be effective. And then recommended against would be the red triangle. Great news, there's no red triangles on this. And one major thing is if you see the yellow diamonds, most of those are things that are taken alone. But if you combine them with some other things, then they become recommended. The only one that is really not sufficient evidence is if you look at just the client held paper immunization records, and we know like how that went. We went through a wonderful activity with COVID where we had these cards and we're handing them out and then patients don't have them. So we know nobody's carrying that around, like access these days. So just looking through some of these and thinking through how you can implement some of these in combination on a daily basis. Next slide. All right, so when you think about the client-directed pharmacy evidence-based interventions, that'll be the first group we go over. Client reminders. How many of you have leveraged client reminders in any shape or form when it comes to increasing vaccine uptake? Anybody want to either come off mute or put it in the chat? Some of those include email reminders, birthday campaigns when it comes to 9 to 18-year-olds. I know we're always getting that email on a yearly basis from everybody, I'm loved, because my doctor or dentist is like, happy birthday. Don't forget to come in and get your teeth cleaned. We have app reminders and banners, text message reminders. I think digital has just taken us to a whole new level. We have whole messages, so we know we have automation that we can use. Did you know starting at 9, your child is due for HPV vaccine? Automated reminder calls to patients 9 through 26. Also, reminder calls for that second and third dose. I think that's really key. How do we get patients to come back in for a series of vaccinations? And if you have any best practices for that, please throw that in the chat as well. And then inform of any vaccination events happening in the pharmacy. We have Deborah that says when she do a couple dose shots, she will write the next time needed on the leaflet form. Yep, series completion is very important, Roxanne, I agree. So just writing it out on the leaflet, hey, got shot 1 today, and this is the day we need you to return. That is an excellent example. Also important to recommend the vaccine, even if they have contracted HPV, over 150 strains, so vital. That was shared by Ashley in the chat. All right, next client-directed EBI, small media. So do we have posters up in the pharmacy? Stanchions with vaccines available. I know there's all kinds of signage available that goes through what patients can encounter at the pharmacy. Informational sheets stapled and stuffed in prescription bags, stickers to close the prescription bag, buttons for your team. Ask me about HPV vaccines. Social media messages. We see a lot just around women's health these days across all social media platforms. So that could be another great combination, as well as when we have, No Shave November for men. How do we, talk to them about vaccines when they already have this kind of heightened acceptance of, getting self-care and health taken care of? And then any aisle messaging. Did you know we provide these common vaccines in our pharmacy? Ask a pharmacist today. Again, if you have used any of these, we'd like to see a cosign in the chat or just anything that we might not have mentioned yet. Feel free to make it engaging and participate. Next slide. One-on-one education. And we know sometimes this is what flips our patients who might have previously been hesitant, haven't really given it much thought. When you give them that strong recommendation, using that presumptive approach we covered last time and we'll cover in a little bit, they're more likely to be vaccinated. And then answer any hesitancies with facts and use motivational interviewing techniques, whether it's, the safety, the efficiency, just use all of the facts that you have at your disposal. And great news, as we continue through this, we have all the resources that you need to be able to make those strong recommendations. Next slide. All right, so this takes us right to it. Pharmacists, a strong recommendation for the HPV vaccine matters. Next slide. When you look at our recommendations, this population is going to be what we are looking at kind of as our sample population. And we know that our recommendations as pharmacists to get vaccines is super powerful. Next slide. We know that without a recommendation, about 47% or so will be vaccinated. But then on the next slide, when you see when we do make that recommendation, that presumptive, powerful recommendation, we can get that up to 75%. So how great would that be if we could get 75% of our patient population vaccinated against HPV and other vaccine preventable diseases? Yep, great idea. January for cervical cancer month. So many months that correlate to the HPV vaccine. I like that. Cancer Prevention Month in February. Great segue for HPV vaccine. All right, next slide. All right, pharmacists and the public trust. As you can see, I discussed earlier how pharmacists are the most accessible healthcare providers, but we're also consistently ranked with physicians as among the most trusted healthcare professionals in the United States. So we slid back by about 1%. But don't worry, we can overtake that top spot again. The question that is asked is how would you rate the honesty and ethical standards of people in these different fields? And pharmacists are rated at that 55%. So leverage your position as an expert in medications, including vaccines. Next slide. Looking at the effective and powerful recommendations, if you have a 9 to 10-year-old parent in the pharmacy and you want to make a strong recommendation to them, you want to look at that presumptive and reasonable declaration. You want to discuss how the HPV vaccine is just like any other vaccine. We saw that chart. Parents are vaccinating for flu. We just need them to understand that HPV vaccine is just like any other vaccine. What's more important is that cancer can be prevented in boys and girls with the HPV vaccine. So we have Max, he's 9 years old. You'll say, Max is 9 years old, which means he's due for his first dose of the HPV vaccine. I can call and get a prescription from his doctor so he can be vaccinated today, like right now. This vaccine protects against 6 types of cancers. And Erica reviewed for us those 6 types of cancers, which ones are leading. So if you think through being able to provide that additional insight to parents, it can really make a difference. Next slide. What about an 11 to 12-year-old? You might say, Selena is 11. She is now due for 3 vaccines. These vaccines prevent against meningitis, HPV cancers, and whooping cough. We can contact your provider to get a prescription so she can receive these vaccinations today. Again, you're being presumptive and making that strong recommendation to get it done today. Don't let them leave the pharmacy without getting their vaccine. Next slide. And then finally, for a patient that is 14 and up, our records show that Juan is 14 and is overdue for his HPV vaccination. This vaccine protects against 6 types of cancer, 3 of which affect men. We can provide that vaccination today. Again, making patients understand the seriousness, the fact that, hey, they might be overdue, they're due, but we can take care of that today. I think offering that solution really makes the difference. Next slide. All right, then we move to some client-directed pharmacy evidence-based intervention. So there's group education, where we can partner with local school public health departments or community organizations to share on the importance of the HPV vaccination, host a vaccination educational event at your pharmacy, and offer vaccinations at the end of the event. So if you've done something similar in your pharmacy, it'd be great if you could share. I think the biggest thing here, we've all heard of brown bags and white bags events where we're, working with different community partners to educate. You could do the same thing for HPV vaccination. A lot of times our local schools are, looking for partnerships, and that would be an easy opportunity to get in front of the school, parents, and the students. Next slide. Assessment and feedback. So find your baseline. Today, if you're in your store working, you want to know, how many HPV vaccines have I given? How do I compare to, peers? How does HPV compare to other vaccinations that I'm giving? And what kind of gap do I want to use, or what kind of gap do I need to close? And what time frame would I like to get that completed in? And then analyze and compare data at regular time intervals. So did you set out to say, okay, we're going to start a campaign around Cancer Prevention Month? We started at baseline with X amount. We'd like to increase that by, at least one additional patient a day. So setting that goal and then coming back to review it can really help close the gap. Next slide. Pharmacist reminders. So sometimes we have so many things going on, we might not know. Is there an automatic flag that you can put in your computer system? A flag on prescriptions for patients between the age of 9 and 26 to remind them. And then the pharmacist and technician can have that conversation. So sometimes we just need a reminder, whether it's through the prescription filling process or once it's been filled, that, hey, this patient is actually eligible for a vaccine. What do I need to do to get them vaccinated and make that recommendation? Next slide. Patient navigation. As we discussed before, looking at helping uninsured and underinsured patients find a community clinic. And this is all, I think, patients who might not have coverage for HPV. So maybe they come in and they have prescription coverage, but when you run the HPV vaccine, it might be a little bit too expensive for them. Make sure you make that referral. Don't just leave it at that. Say, hey, we can't give it, but let me give you some resources to get you taken care of, so that way, you've given the resource, and maybe even follow up the next time you see them in the pharmacy. Next slide. Reduce the structural barriers. So we already know our pharmacies are open into the evening, offer vaccinations after working hours on weekends, partnering with those schools and community organizations, mobile clinics, and then pair your HPV vaccine with others. I discussed a little bit earlier, the incidence of influenza-like illness is super high right now across Texas. It's very high. So when the public sees that, as well as the temperatures dropping, they're more likely to want to come in and get vaccinated for those seasonal respiratory issues. Use that time to get them vaccinated and to get them caught up. And then again, help those or underinsured patients find a community clinic or TVFC program to be taken care of. Next. Looking at patient incentives or rewards, is there a coupon for completing a dose that you could do, a coupon for completing an entire series, or is there any waiving of fees that you might be able to do to just better incentivize patients for getting the vaccine? I think we all remember when the COVID vaccine first came out, a lot of community organizations were doing incentives to get the public vaccinated. So as you think about those things, kind of think outside of the box. Next slide. All right. So being an immunization champion is super important, not only for us, but we know for our pharmacy technicians as well. On the next slide, there is a quote that I love. Pharmacists are not just the medication experts, they are also the vaccine experts. And that is from the Texas Pharmacy Association. The educational services pharmacists provide can enhance public awareness and willingness to obtain vaccinations. As frontline healthcare providers, pharmacists can significantly influence vaccination rates through educational incentives, vaccine availability, and documentation for their patients and communities. Next slide. We know that our pharmacy technicians also have opportunities to impact vaccine uptake. If you have any ways that your pharmacy technicians are helping impact vaccine uptake, please share them in the chat. I know sometimes it's as little as, a conversation starter. So pre-administration, they can definitely check the patient's HPV vaccine status through state immunization registries and other registries. Notify parent and guardian that the pharmacist would like to talk to them about vaccines for their children. So getting the hand off for us to leverage the power of the white coat. Administration, when you look at how our technicians can definitely coordinate getting that vaccine order. Although they cannot give it here in the state of Texas, they can definitely coordinate with the PCP for vaccine orders. They can enter those into the system. They can process insurance claims, gathering the supplies that you need to give the vaccine. And then post-administration, we talked about, some of those recall and follow-ups when it's a series vaccine, so multiple doses. They can schedule that follow-up appointment. They can document those doses received, and they can absolutely notify the PCP of those doses administered. So don't be afraid to delegate and bring them in to this process. All right, so let's quickly go through some tools and resources so that you can be equipped with all the knowledge that you need to make that strong presumptive recommendation. Next slide. So some important websites are the American Cancer Society website. You can go directly to cancer.org/HPV or VPH, the HPV Vaccination Roundtable, and then the CDC. Next slide. There are several patient and provider resources that you can leverage. Take a shot at cancer, protecting our children, and don't wait to vaccinate posters can definitely engage. We talked about a lot of the small media as an EBI. Next slide. And then the National HPV Vaccination Roundtable. If you haven't heard of it, the National HPV Vaccination Roundtable is a coalition of about 70 organizations working at the intersection of immunization and cancer prevention. Founded in 2014 by the American Cancer Society and the Centers for Disease Control and Prevention. The mission of the roundtable is to raise HPV vaccination rates and prevent HPV cancers. You can learn more about that at the link below. Again, all of this will be sent out in the post-event recap. Next slide. Some additional resources that are available. We talked about the small media, flyers, posters, social media toolkit, the Age 9 article collection. If you are one of those people who just really loves peer-reviewed articles, you can take a look there. If you look at videos, presentations, action guides, letter templates, and so much more. And then finally, the Centers for Disease Control has a wealth of resources as well. Something that help ease the conversation when you want to talk to patients about the HPV vaccine, as well as answering a lot of the questions when it comes to safety and effectiveness. Next slide. All right, with that, Ashley, I will send it over to you. If there are any additional questions or comments, please put them in the chat.
Perfect. Thank you, Chantel and Erica, for a wonderful presentation today. So we are now going to go into a panel to discuss questions and have you guys share your experience with HPV vaccinations. So joining Erica and Chantel is Tram Nguyen. She's a registered manager on-site pharmacy at Walgreens Specialty at Crowfoot, MD. So thank you all for joining today. I think there were a couple of questions, and I'm going to throw this to Chantal and Tram. Can you share if pharmacists at Walgreens can gain access to MTRAC or the State Immunization Registry?
I know Walgreens, like you have to have a login and stuff for MTRAC, but we don't have direct access to MTRAC.
Perfect. Thank you, Tram. Another question came into the chat surrounding scripting for under 14. So I don't know, Chantel or Tram, if you guys want to just clarify what that might look like and just those age groupings.
Well, under 14, we can't administer. We have to have a prescription for that under 14 because our age group is 14 to 45. And so if they're beyond that age limit, we have to get a prescription from the prescriber.
Okay.
And then it would have to be administered by the prescriber.
Okay, perfect. Thank you for clarifying. I appreciate that. We'll continue to get questions into the chat, but I thought we could go into some other discussion. So, each of you, has different roles within pharmacy. So, in your opinion, what are the biggest opportunities for pharmacists when it comes to HPV vaccination? So, we'll start with Tram and then go to Erica and then Chantel.
Well, for me, because I work in a infectious disease clinic, we typically our clientele includes, a lot of males and transgender. And so every day I make a recommendation, or we provide a recommendation to the providers in the office, um, all immunization recommendations. And so that's how we typically promote our immunizations. And the providers are on board. They are very active in promoting that, all the vaccinations are up to date. So, I am like annually, we probably administer about 500 vaccines total. Um, so as far as barriers, most of my clientele um are very they're not against getting vaccinated. They are pro vaccination. Like anytime there's a new one or something that comes out, they're always asking about it. So in that sense, I really don't have too many barriers as far as making recommendations and, getting convincing the patients to receiving the vaccination.
Yeah, and I would just say, from my perspective, it's really just the pharmacist making that initial recommendation, because a lot of times parents, or if we're talking over 14, and young adults, they just might not be aware. Sometimes patients aren't aware that different indications and recommendations change. Previously, over 26, or whatever the case may be. So just as things change and update, just make sure you keep that conversation open with your patients so that they're always aware. And then you can open the conversation to so many other things. And they really just want that strong recommendation. I always say, when I go to the doctor, a lot of times my doctor's not like, would you like to do this today? They're like, you're here, you're going to do it. And so, when we take those recommendations very seriously, I think that's probably the biggest part, if we could just overcome feeling comfortable with making a strong recommendation.
Perfect, Chantel. And I will say, as a mother of three, my pharmacist knows me very well, especially during the season. So yes. Erica, what are your thoughts? What are some of the biggest opportunities for pharmacists?
So taking a step back, because I'm in the public health field and kind of think about HPV vaccination broadly, I think it's just really emphasizing that pharmacists are an important part of our overall vaccine strategy, that you are important vaccinators to the equation, in addition to pediatricians or primary care providers, and it sounds like from this group, you all are enthusiastic about that role, but really owning that role and helping bring that awareness to the community so we can have an overall patchwork of a vaccine strategy so we're capturing the most folks possible and vaccinating our children.
Perfect, Erica. Thank you for that perspective. So we talked a lot about interventions today and in this conversation, but would love to get your thoughts. Which one actually stood out to you and something that you think that you could easily implement as a pharmacist? So I will throw it to Chantel first, and then go Erica, and then Tram.
Yeah, there were so many great. That's why I was in the presentation asking for folks to chime in, because I really like to hear, hey, have you heard of any of these, or have these really worked for anyone? I really like the ideas about like small media campaigns and social media campaigns, because I think that's where we live most of the time now. It's like, oh, I saw, something that said I might want to reach out to my healthcare professional to learn more about HPV vaccination. So I think that those are really, really impactful. And then I think second to that is anytime you can remind, a patient about something through, various digital channels, that's always helpful as well, because we're all, overscheduled and so busy. So how can we continue to remember, taking care of ourselves and getting the things that we need?
And I love the strategies that Chantel shared. I think, for again, taking that step back, public health perspective, I am not a pharmacist. That's a big disclaimer. But it's thinking about these interventions in combination. So I know you all as pharmacists have a lot on your plate that you're having to do on a daily basis. And so if there are those kind of passive types of interventions that can occur, so the ones that Chantel was describing in terms of like digital outreach or things like that to help prime the patient population to know this is an option, but also then layering that with your strong recommendation or different client incentives or reminders. So these combination of items can really make sure, if something drops off, then another one is filling it. And every patient's a little different in terms of maybe their level of vaccine hesitancy or acceptance. So having those multiple layers of intervention can really support whatever the needs may be of that particular patient in deciding around HPV vaccination.
So I think I second Chantel on as far as having those reminders. A lot of my patients, they fail to get their second dose or complete the series. I have a lot of patients that come in and ask, "Oh, do I need to restart because I started a long time ago?" So it's definitely those reminders really, really do help. Like for us at our site, we have a program where we'll put in reminder calls to the patient in advance. So let's say the patient finished their first dose. So like the second dose, we would have a date set to remind the patient, to come in for their second dose. And even with those reminders, sometimes, the patients forget and things like that, and they'll need additional reminders. So to me, definitely the barriers to completing the series would, just getting them to come in to complete the series. So reminders are very, very helpful.
Perfect. I really love that each of you kind of talked about different interventions, and touching on what Erica said, like you can do, it's best to do multiple interventions in combination. So I really like that. Tram, I really liked how you talked about the reminders. And pharmacy, you guys have a lot of opportunity when it comes to reminders, just because you've got, text messages, you've got phone calls, all of that. And then Chantal, what you were talking about with, small media and social media. I know Roxanne said she learned from social media she had to take the turkey out to defrost it, but it's true, right?
Embarrassingly, yes.
Yeah, is that you have to, it's where we learn everything today. And we actually have a brand new social media toolkit coming out in early 2025. So we'll make sure to share it with this group because I think it would be really great. It's based on the different months. It's things that it's images you can just copy and paste into a social media, site and be able to, tweak it how you best want it. But it might be a really great tool for all of you. So we'll make sure to get that. One last question before we wrap up, and this one I'm going to throw to Chantal and Tram, but thinking about pharmacists in pharmacies, how can they advocate for policies that support increased HPV vaccination, in their settings?
Yeah, you're speaking my language, Ashley. So I think, in the state of Texas, our legislature only meets once every other year. I don't know if everybody knows that. But just thinking through your level of advocacy when it comes to talking to people who are in charge of policy. So we know we did get a PrEP Act extension, but what we want is that full immunization authority. So talking to the folks that make decisions, your constituents of theirs, there are so many resources available to kind of walk you through those processes. It really does help. And what they want to hear is like stories of your patients. How did you impact somebody's life positively? Somebody that lives in their community, to really think about how we can continue to advance the practice of pharmacy. And then I think the other thing is just making sure that you continue to advocate for yourselves as pharmacists with the things that, we have to balance. Everybody says, oh, there's so much on your plate. So thinking about the things that you have to balance and advocating for that as well.
I completely agree with Chantel. Everything is, you have to advocate for yourself and then you also for your profession. Again, it's always have to go through the legislature. Unfortunately, Texas is only once a year, like she said. But yeah, definitely advocacy is the goal.
Perfect. Thank you. And I really hope that, Texas things will expand for you guys. Like I said, my pharmacist knows me really well. So if he were to tell me to vaccinate one of my children, I would fully trust. So thank you, Erica, Chantal, and Tram, for being a part of today's panel and for sharing your knowledge and your expertise. We really appreciate it, and you've really made this session very robust with conversation, so thank you. We are going to move to closing out today's call, so I'm going to have Hannah go ahead and start sharing those slides. Perfect. So we are going to wrap up today's session and just share a few resources to support your work as HPV vaccination champions. We are going to wrap up with doing another quick poll. So this is the same poll that we had at the start of the meeting. We'd love to see, if your knowledge changed, especially around increasing HPV vaccination uptake, your knowledge around evidence-based interventions, whether or not you will be routinely recommending the HPV vaccine to customers between the ages of 9 and 26, and then if you plan to implement one intervention as a result of today's session. So I'll give you guys a couple of minutes to go ahead and fill out that poll. Looks like we've got more than 25% participation so far, so please feel free to share your thoughts and your feedback. Looks like we're halfway there. We've got 50% participation. Love to see it get to close to 75 if possible. We're almost there. We're at 65%. So we could just get a couple of more individuals just to share their thoughts. We're at 69%. If I could get two more participants, that would be ideal. All right, we're at 73%. Kayla, why don't you go ahead and end that poll and we can share the results out. Oh, we got to 76%, so thank you for that last minute participation. So it looks like a majority of you plan to or understand your role in increasing HPV vaccination uptake. So that's great. Appreciate you all for sharing that. Knowledgeable on evidence-based interventions. Majority are agree and strongly agree. So I think we've done our job there. Will be routinely recommending HPV vaccination to customers ages 9 to 26. So majority of you say agree or strongly agree. There are a couple that don't agree at all or disagree. So that's okay. And as a result of today's webinar, each of you plan to implement at least one intervention, and majority say strongly or agree. So thank you all. It seems like we did a great job of sharing out what we needed to. So okay, go ahead to the next slide. So we've shared a lot of resources during today's session and our previous session. We've actually organized a really nice resource roundup with resources shared from today's call. And we'll be updating this document to include the resources from our November and our December sessions. You will receive this in that follow-up email we send, hoping to send that tomorrow. So look for that in your email inbox. If you want to go to the next slide. So just to wrap up today's session, I do want to share that you can help all of us by sharing out our Enduring Continuing Education for this pharmacy series. So our first session will be available for Enduring Continuing Education until December 3rd of 2025. So little less than a year from now, but almost full 12 months. And then our session 2 will be available until December 13th of 2025. So I'm going to have Kayla link our YouTube playlist in the chat. Please feel free to send this to all of your colleagues and throughout your network, because those continuing education, like I said, will will be available till next December. So it's a great opportunity for colleagues to be able to receive that. Next slide. All right, so we want to know how today went, what you really liked, and what could go better. We're asking participants to complete the post-session survey to share feedback and to claim those continuing education credits. So in order to receive credit for this activity, the participant must have attended the live webinar in its entirety, answer the post-test questions with receiving a 70% or better, and complete the program evaluation. For pharmacy CE credits, they will be uploaded to the CPE Monitor within 2 to 3 weeks of evaluation completion. Pharmacist learners cannot claim credit after 60 days of the session's conclusion. For those that are non-pharmacy learners, they will receive a participation certificate of completion within 2 to 3 weeks of their evaluation completion. Next slide. Similarly, for those who are listening to this session in the future, please scan this QR code on the slide to receive credit for this activity. We've also included a link to the Enduring CE information in the information section of this session. In order to receive credit for this activity for Enduring CE, the participant must watch the video in its entirety, answer the post-test questions with a 70% or better, and complete the program evaluation. Once again, it will be for pharmacy CE credits, it will be uploaded to CEP Monitor within 3 to 4 weeks of eval completion, and pharmacy learners cannot claim credit after 60 days of completion. For those that are non-pharmacy learners, you will receive a participation certificate of completion within 3 to 4 weeks of evaluation completion. And this session, once again, will be available for enduring continuing education until December 13th of 2025. Next slide. And lastly, we want to thank all of you for joining today's session, and we wish you all a very happy holidays and look forward to seeing you in the future.